Welcome back, listeners. I'm Robin Black, and this is It's All About Healing podcast. I have a wonderful guest with me today that I'll be interviewing, Dr. Ruchi. She is going to be speaking to us today about mental health and also depression. Thank you so much for coming on. How are you today?
First of all, Robin, it's my pleasure to be on this platform, and I really want to thank you because you are doing this. Because I really think that mental health is not a responsibility of one person; it's a combined efforts. And I really want to appreciate and thank you to create this platform where we can all sit and talk and can openly discuss about it and can spread this
Absolutely.
awareness.
Absolutely. I agree. I agree. So, what did you want to start off with the topic today about depression? Because I know that's a very, very large issue in the world today. So, what do you have to say in regards to that?
Yeah, that's true. It's like a huge issue. So first of all, I would like to start by, clearing two terms which I have seen people often interchangeably use, sadness and depression. Something happens and I'm depressed. So first of all, I like to clear cut the definition what sadness is and what depression is.
Okay.
Sadness is an emotion. Suppose you lost your job or something has happened in your family or with yourself, and you are kind of sad for something, feeling of low mood of for short time, and it goes away with time, and it does not hamper your daily day-to-day activity. But
Mhm.
depression, on the other hand, it's a mood disorder where you have certain other symptoms with it, like crying spells. You cry for no reason, no valid reason. You start crying, you will have increased crying spells. Insomnia, difficulty in sleeping. Anhedonia, which is like very common, it's like losing interest in things which you were fond of. You really don't want
Oh,
to do activities you like, your hobbies. You are like, no, I don't want to
mhm.
do this. Isolation, and at its worst, suicidal thoughts. It hit very badly in the major cases of depression. So
Mhm.
I want to just start with this thing to make people understand that what sadness is and what depression is. There is a clear cut boundary, and depression is something which is definitely a very big issue and
Okay.
need to ponder and discuss on.
Absolutely. So, what is the difference between the two? Because once you experience so much sadness, that's what kind of puts you into depression, correct?
So, if the feeling of sadness persists for a long time, generally what happens is like we have natural hormones, serotonin, so endogenous hormones, if they plays their roles. So, what happens is if a feeling or persistent feeling of sadness happens, and first and foremost you can identify, like you will have difficulty in doing your daily day-to-day activity like brushing your teeth. You don't want to get out of your bed, you want to but you can't. If this kind
Yeah.
of paralyzing things is happening, that definitely your condition is going towards a mood disorder, that is a depression, and that
Okay.
definitely we need to take care of it. Okay, something is wrong. So this is the
Wow.
this
Okay.
is the clear cut line where we can see what depression is, what sadness. In sadness, okay, you have low mood, but you do your activity. But
Right.
depression is kind of paralyzing. Paralyzing in the sense you want to do, you want to get out of your bed, but you can't. So this is what
Right.
depression is.
Right. So, what would you suggest? Like, how can someone kind of tell the difference to be able to differentiate the difference? I mean, I understand that you said when you're depressed, it makes you not want to do anything, you're not interested in anything, but how do they know that they're not just on autopilot, that they really are depressed and they don't really realize it?
So, first and foremost, like you asked, ki how they really can say, see, depression comes under neurosis. Most of the time, the patient or the person identifies it. He generally talks with people, no, something is wrong, something is wrong. I
Mhm.
want to, but I can't. When
Right.
this thought comes in your mind, I want to, but I can't. But why is this happening? Why I want to earlier, whichever activities I used to enjoy, why I'm not able to enjoy those? Why I'm like isolated? Why I don't want to talk to people? Why I have these anxious thoughts about like
Mhm.
talking, meeting with people, and also hygiene. It is also a very big aspect where you don't care about your personal grooming, hygiene. So here's where people can, a person can identify, no, I'm going through something. But yes, I would agree with you. What happens generally, like we generally talk with someone, the closest one, family or friend, like, yeah, I have this thing I'm feeling, what should I do? So this is the first step a person should do and can do
Mhm. And
about it.
then you said sometimes, they don't really want to talk to others, they don't really want to interact with others, but sometimes wouldn't you say that introverts are kind of like that as well? Like, how do you know that someone's not just being introverted versus someone being depressed?
Yeah, so this thing with depression is like if it goes on, it kind of like I earlier said, kind of paralyzes you to do the activity. Like if you have your job, you won't be able to focus on it, lose loss of concentration, anhedonia. Like if you have like compulsory meetings you have to present, you won't be able to focus and prepare for it nicely. It will reflect on your work, on your studies, your grades. It would be evident. You can
Mhm.
see that yes, something is wrong with this
Okay,
person.
that
And
makes sense.
also the thoughts, suicidal thoughts, it happens. Like if you don't keep check on it, with times you started having these like thoughts, what is the meaning of this life, I should end
Hmm.
this. And your thought pattern, you can analyze it, like they have like direct shift from whatever you used to have kind of personality.
Right, right. And what would you suggest for people who are suffering with depression? Because I know we all like to hide when we are suffering from that, but what would you suggest them do?
Yeah, so Robin, today I want to just discuss with you like cognitive behavior therapy. We already all must have heard about it, whoever go to psychotherapy. And one important aspect of it is cognitive distortion. So what it is, first of all, I like to start with this. See, what is cognition? Cognition means your ability of brain to think. And what is cognition distortion means that this ability of brain to think has been distorted. First of all, I want to start with why it is important to study about cognitive distortion and why how it can help in a person who is suffering from depression, because we can see this loop. Whatever like experience we have in this world, like positive, negative, like suppose I went to a meeting and I presented myself, my presentation I did, I got some reviews. So I have this thought in my mind after I coming back. I have this thought, good or bad. Okay, some people said good and some people said bad. But if I'm suffering from depression, my mostly thoughts would be, oh, this person said bad. I didn't good well. I didn't do well and like this. And this thought will create an emotion. What kind of emotion I'll have? Either I'll get angry or sad. And then this will reflect in my behavior. Either I will isolate myself or either I will go fight with that person. So there is a loop. Every even we are having like thought. Every thought creates an emotion, and then we have behavior. For us, like we have like happy thoughts also, then we have happy emotions, and that's how it reflect in our behavior and actions.
Hmm.
But what happens in depression is if you don't break this cycle of negativity, like thoughts, emotions, behavior, at any point, you will caught in that loop. You will have those negative thoughts, negative emotions, then your behavior. Like you will isolate, you will fight, you will irritate. So our main purpose in this cognitive behavioral therapy is to break this chain. And at the very first stage, if you analyze your thought, whatever thought you are getting, and just analyze it, okay, if this is truth or not, and how you can rationally counteract it. It is a practice. I know whenever I'm talking, when I know that it's a practice, but it's a very important and a very effective technique where you can analyze your thought, and you can only work on it, and you can see the positive impact of it. So Robin, today, yeah, continue.
No, no, what were you saying?
No, I was just telling that today I just want to highlight the most important type of distortion which we see in depression, and what they mean and how we can overcome it. And everyone can, those who are going, those might have been through depression, can while listening to this can relate to it. Okay, these are very common type of thought distortion which we all go through. So, first of all, I want to start with all or none thinking. So, all or none thinking pattern says like, suppose I went like I had like, participated in an exam or something and I didn't do well. So, what this pattern says is like black and white. This is like, okay, you didn't do this thing right. That means you are good for nothing. This is what your brain says. So, but what we have to tell ourselves, what would be the rational response is that life always goes in a gray scale. There is no black and white. Life always,
Mhm.
if you lost today, the other day you can win this. So this is how
Mhm.
exam is, so this is how life is. So this is the most common thinking pattern, cognitive distortion. First is all or none thinking. And second is, I can see, is overgeneralization. What it creates is all or none thinking is overgeneralize. Suppose one bad event occur. Your brain will tell everything is bad in your life. You overgeneralize that small incident which happened to you. Suppose someone in your family or someone has said bad to you. You overgeneralize. Okay, I'm good for nothing. I did nothing good in my life. That's why this is happening. Or my life is like this. So how can we counteract it? First, we have to analyze it. If our brain is telling that we are good for nothing and my life is a failure, I have did nothing. And I personally think if you are getting a bread and butter for a day, you are already in a very good position if you see the world. If you are not,
Right.
the cancer patients, you can see from them. So you have to realize this is all what your brain is telling you. It's not the
Mhm.
reality, because it is
Mhm.
only picking you the negative events and it's over generalizing a small event to think you in that way, in a depressive way.
Mhm.
Another thing is, Robin, which is also very important, is mental filter. Like, what happens is, like, if we go through a situation, like I talked about that meeting example, some people critic you, your thing, some people praised you. But what your brain will do, you will only pick the negativity. Okay, that certain person commented negative about me, and you will so much indulge it. You will just disqualify all the positive people have said and all the
Yeah.
things you can do, and you will just focus on that negativity and the negative, the critic. Or you also take it as a positive, positive review. But what your brain will do, it will take it totally, in a negative way, and will indulge in it without correcting it or thinking what is wrong, what happened, why did the person comment it that way, maybe something wrong in my presentation also, or I can work on it. So
Right.
another very important thing is mental filter. You have to analyze it. If you see everything in a very negative way, every event in a negative way, you have to, think and sit. Is this the truth? Some people also said positive about my presentation or something with that, whichever event had happened, and I can't disqualify the positive. And maybe
Mhm.
it could be a positive, comment about me. I can work on it. I can improve myself. So this is also a very important type of, cognitive distortion, disqualifying the positive and a negative mental filter, which is seen. And
Yeah.
another thing, yeah, yeah.
No, I was just saying, it's just I noticed that I do that sometimes. I think
Very,
we're all
very
guilty of
common.
doing that where we only hear the negative and then we
So,
focus on that. And it's just like, how do we get out of that? I think that's what kind of causes us to go into the self sabotage and kind of, now all I'm focusing on is this one negative thing that they said, even though they said 13 other positive things, I don't
exactly.
hear those anymore. So, what would you suggest? I know you said analyzing it, but when you're in that moment, it's not very easy to start analyzing, well, this is all the great things that they said about me because we internalize those thoughts. So, what would you suggest for people who are in that position right now, like just at the spur of a moment? What do they do when they're trying to analyze the negative from the positive thing that was just said to
Yeah, even I completely agree with you. If you take my example, the same thing happens, because I pick why this person said this, what is wrong with me. But this is only we can do, or even I do. I just sit back, I analyze, like I recall whole event which happened, and I just
them?
write it down. If, like, in when you write it down, you can see some positive things have happened, and you have to tell yourself, see, this is the exercise that you have to do. Otherwise, what happened, like your brain only pick yourself into the negative event. Then I'll tell myself, okay, out of like 13 comments, if I have like 8 positive and like rest of them negative, and if I can work on these negative, some comments are like I can't work, so that is fine. Something you have to accept also in life. This is also, I think, the most important part of life is something you have to accept. You can't make everyone love you or like you. This is
Yeah.
also the reality. But if you can see, okay, this is the area where I can work and can improve, and take it as a positive feedback, and it can, improve your work, you can take it. And somewhere you can see, no, yeah, I can't do anything about it, and it's like a personal statement on me, and you can just accept that person. Okay, this is as it is, I can't do anything about it. So whatever area I can work, I'll work, and I have to accept this thing also. So this is what I do, Robin, personally. Sometimes I accept people. Okay, this is what it is. I can't change anything about it, but I can't
Mhm.
let my brain harm it, because it will create no good for me.
Right. Okay. I understand that one. Thank you for that.
It's
And what
it's
were the
like
other?
everyday exercise for every one of us actually. Everyone goes
Yeah.
through a lot. It's a daily exercise that we have to do.
Yeah, absolutely. And what were the other things? I'm sorry, I didn't mean to. I just had to kind of throw my question in there, but what were the other things that you were listing?
So, consequently, what happens in these, like we discussed all the most important cognitive distortion. What ultimately what these lead to is emotional reasoning. See what happened, like whatever situation we have to make a decision or analyze it. Generally, we normally we do rational reasoning as well. Like what is practical application? Okay, this thing you couldn't work out, so let's not. But what happened in depression is mostly you do the emotional reasoning. What is meant by emotional reasoning? You go by your emotion. I don't like this person, that's why I don't want to work with this person. It's a kind of emotional reasoning. You won't see, no, something is like you are working with him or her, I learn something. No, what how emotional reasoning works is you go by your emotion. So this is the kind of negative impact the depression, or we can this type of thought distortion is you don't do the logical reasoning. You don't give the logic for a situation. You just go by your emotions. If you are angry, you are like, no, I won't work, or I don't deal with the situation. You just go with your emotions. You don't have control over your emotions. Generally, normally we do control. Sometimes we are angry, but we control and we go by what the situation demands. But sometimes when this distortions overpower you, you lose your power to logically or rationally react. You go by your emotions and you do your emotional reasoning, which kind of sometimes deteriorate the condition, the situation with the person whoever is going through or in that scenario. So this is something I like to highlight, like emotional reasoning. And another is personalization. See, generally it happens whenever we do something wrong, we say, okay, this is my responsibility. But personalization kind of cognitive distortion is something you are not that responsible for. But it's
Mhm.
kind of crippling guilt. You are like, no, I did this thing wrong. It's not even necessary that you are the part of that, condition, and you are the only one. But your brain or your thought pattern have taken into such a negative phase that you take everything, like your personalization, you take into personally. Okay, this is my fault, I am doing wrong. I am like whatever thing I perform, like whatever task or something, it's kind of I'm responsible for making it wrong. So, like Robin, I've discussed the most important, but like after while discussing, also we analyzed somewhere these all thought distortion leading us to a more negative way, and kind of causing a crippling guilt on ourselves. Like we
Mhm.
are bad, we are good for nothing. This kind of. So the idea behind this analyzing this cognitive distortion is to keep track of your thought. Whatever thought you are getting, just initially we say to patient is to just write it down. And because it's tough to do everything in your brain, what we say to patient, just write your automatic thought. Whatever your thought you are getting, like I'm good for nothing, whatever thought, just write it down, automatic thought.
Mhm.
Next, you have to do is you have to write the cognitive distortion. Like Robin, we have discussed the type of cognitive distortion. Like if I have failed one exam and I write like, okay, I failed one exam, I'm good for nothing. Just write all or none thinking, because my brain is telling failing one exam is telling I'm failed in life. This is of course not
Right.
true. So
Mhm.
you and the in the third column you have to counteract it. You have to write the rational response, which you can even imagine after analyzing that cognitive distortion. You can say, no, failing one exam does not prove that I'm a failure for life. It's a life. Sometime I fail, sometime I pass. I passed my last exam. So this is what this triple column technique, which we called, and how to apply it. This is the practical application of this cognitive distortion, how to analyze it. First you have to write down every negative single thought. Just write down as it is, just write down. Analyze what kind of thought distortion it is depicting. Is it personalization, overgeneralization? It's kind of mental filter. And then write the rational response, the logic. If you can think about it nicely, And even you can analyze, like, okay, this is a distorted thought, my brain is only thinking in a negative way. I can rationally prove it, no, this is not right. So this is like triple column technique, and it's a very effective. How it works is, if you continue this like for like days, you will analyze the, like, suppose today I wrote like 30 thoughts. Tomorrow, day after tomorrow, I like it will decrease, because what you are doing, you are fighting with your own thoughts. So with time, these kind of synapses in your brain gets lighten up, you, because you have your weapon with you, you understand that these are the distorted thought, you have that insight. So with time, these kind of thoughts is getting feeding up, get is let's start getting faded up. And if you combine these like techniques with other techniques, like maintaining daily activity schedule, pushing yourself to do some physical exercise, or talking with some positive good environment, it's a very effective tool, Robin. I mean, it's a very effective tool to keep track of your depression and to get out of those negative thoughts which we caught into that loop.
I never thought of writing things down. That's actually very helpful. so
I know
anytime
it's a help also.
anytime a negative thought comes up, you're saying, like, say for instance, if there's a lot of people out here who feel that they're not test takers. I am one of them. Even though it's been a long time since I had to take a test. But for us who are bad, who struggle with test taking, so instead, when we do kind of bad on a test, your suggestion would be to write it down and say, well, I passed this other test, and I will, just because I passed this one doesn't mean that I'm failing, but I'll just go ahead and pass the next one. Just kind of write affirmations, basically telling
Yeah.
yourself that you can do it. That way you kind of take your focus off of the negative.
That is the whole point of this activity, to analyze that one incident, one person, or anything. Like, you cannot generalize, or you cannot go because you are the only person, you are the only person responsible, and you are the only person who will be doing everything for you. That is for sure. So definitely you have to be there for yourself. So that is the
Okay.
motto of this thing, and you have to analyze that these are distorted. This is not the what is the reality. Of course, like I said, having a bread and butter for Delhi is also a blessing. We know how like world is going through poverty and everything. So you have to keep telling these are the distorted thought. You have to analyze, and you have to just counteract them. And with time, when you keep doing this, no, these will get faded up. You will get less of thoughts. You can analyze it, you can see it. And if you maintain a diary or in your brain, you can see you will start getting less of these thoughts, because now you're fighting them. You are reacting to them.
Right. Right. And can you also tell us a little bit about yourself that made you get into this, into helping others with this? Because you seem like very passionate about it, and I love that. So can you tell us a little bit about yourself and what made you do this?
Oh, yeah. So, as you said, I have done my bachelor's in medicine from India. So, during when I entered into medical school, everyone has that physical health. I used to think I'll treat patient. I had not so much idea about what mental health is. But when I get confronted in my psychiatric ward, when I saw the grim situation that it can make you kill yourself, that is suicide. Because Robin, even if single infection happens, we get scared. Oh, what, I should not harm us. But an illness which can make you kill yourself, suicide, that I thought it's something, it's a very dangerous thing, and it should
Hmm.
be taken care of. And when I saw like how people react, it's still stigmatized, taboo in most part of the world. People are not free to talk about it. People take it as some people like abandon those who are suffering from this. So I
Hmm.
think that we all should come forward and make a like space for people to talk about it, to discuss about it, because this is not like we can see this is a thing with mental health. You can't see
Hmm.
mental health. This is, I think this is the worst thing people they are having on their head, but they can't tell you that what the person is going through. So that's why I get very passionate about it, because I realize that we all should come forward to make that safe space for people to discuss, where people should not be afraid to get judged, or they should not get judged, or what this person will think about me, and I'm feeling this, if I'm safe to discuss this. We all should have this space for each other. Because at the
Mhm.
end, if we all be there for each other, one act of kindness can literally change someone's life. If
Absolutely.
you This is like I really, Robin, I like one quote, in a world where you can be anything, be kind. I really like this thought. Just be kind, and even if you can't help, just be kind, just be empathetic and compassionate. If you can't help, that's understandable, but just don't say something bad or something that hurts someone, because you can't see his or her mental health, what the person is going through. So just be kind and compassionate. That's all I think. Everyone, if everyone will do this, this will make a huge impact on the world.
Absolutely. Absolutely. And in your opinion, I mean, it's not really a male versus female who struggles the most, but how is that? Is it more like medically, was it medically proven that it's more female versus men or versus male that struggle with depression and internalizing things, or is that not studied?
So no, definitely I would like to differ here. So it's not clinically and all proven, and that among gender how it is differentiated. But definitely it's someone. It does not depend on the gender. I would say depend on the situation. If you are free to talk about it, either you are male or female. If you are a female or a male and you are under a situation where you are not being understood and you are being taken like, okay, what if you are not feeling good, just go out. And if you are not being heard of, so I don't think that it depends on the gender. It depends on the what kind of situation that person is. If he is around those positive or those people who can listen to him or her, that would be beneficial. Otherwise it would be tough to handle the situation.
Okay. And so I don't, where are you located? Are you in Texas, you said
Yeah,
now?
I'm pursuing my
Like,
master's in public health from Texas A&M University.
okay, and for people who are in Texas, where would you suggest, what did you, where, sorry, what would you suggest for them to do or where to go to have someone to speak to that can kind of help them understand more about depression and what they should do as far as talking to someone?
So, my suggestion would be to take, like, if the situation is out of control, like if you are not able, like I initially I said, if you are not able to do your daily day-to-day activity, just take the professional help. Just take the, I can't name the correct, which place to go. Just take the
Uh,
health facility, nearest health facility, whoever would be, the in charge of it. They will definitely refer you to the, psychiatric or the psychotherapy, whichever would be the good for the situation. But my suggestion would be just don't go through it by you alone. Sometimes it's not possible. Talk to your friends or family who can understand you. Tell openly about it. And definitely, I know these days you can even search on the net. There are all helplines and everything would be available. And even I want to give this message, whoever going through suicidal thoughts, it's you should not just let it go. If you are getting it, just talk with your family and friends. Just don't let everything go by yourself and I'll handle it. Just tell your family, talk with your friends, those who can understand you, or take professional help, because this is a condition we should take care of. We can't just let go. And also my message to the people who are with the person who is going through it, just be compassionate and please be be empathetic. Just listen to them. They are already going through a lot. It's not a something which we can take for granted. It's a situation which is making this world go through a lot. So we all should take care of it.
Absolutely. I think if everyone was just a little more kind, a little kinder, that would actually just
Yeah.
work wonders in this world. And that's what we don't have enough of. So I really greatly appreciate the work that you're doing and the message that you're trying to get out there as well.
Thank you, Robin. And like I said initially, I appreciate your work as well. Like, I really want this mental health to be, open space for everyone to talk. It's like a normal conversation, like a table conversation. How are you feeling today? And if someone is not feeling well, just ask, okay, what happened? How can I help you? There are simple words. These can make a huge difference in someone's life or the person, the situation the person is going through. So
Mhm.
that's what I want, that it should be like a table conversation topic, this mental health also.
Yeah. I hope so. That'll be nice. If we could get that going, that would be lovely because that's actually what I would like to do more of. Was when people come on the show, I would want them to speak about that so others know that they're not alone and that there are other people going through the same thing that they have gone through or similar to what they're going through as well.
That is true. That is true. Even when we all come forward, then I know the world will definitely change, and the views and the opinions will definitely. When everyone will come forward and talk about it, it will definitely going to make an impact. Thank you, Robin, for for making this platform.
Oh,
To
no problem at all. Thank you. Thank you. And did you have anything else to add or any more messages as well?
I think I have added everything. I think in the last, my message was, to the people, I've added this to be compassionate. My last message would be that, like, to be more compassionate and empathetic. It is very important. Sometimes, you don't know what the other person is going through. The thing with mental health is why this is, point of concern we can't see. This is the the worst part is mental health. So you have to realize if the other person is not well, not talking, not coming to work, just go and ask them. So just be empathetic and more kind and compassionate. It will create a difference and can make a change in someone's life.
Absolutely. I like that. Thank you so much. Well, that is it for today. Again, I'm Robin Black. This is Dr. Raji, and this is It's All About Healing podcast. Everyone stay blessed. Thank you so much.
Thank you.